Like,
You're on. You're live.
oh.
Hi, guys. Dr. Rob, Michelle
Hold
here.
on. We're not starting yet, but guys, I'm just gonna.
How's that? I got a pillow.
All right, good. No! Make me do that. Just have good posture. Oh, no. No.
Well, whoever's watching can see you. So we are at 12:16. So why don't you guys go ahead, introduce yourselves, and I'm gonna get steady, and go ahead and just start talking.
All right. Hey, guys. Dr. Rob, Michelle here. We're doing another Facebook Live. We're going to be talking about neuromodulators and fillers. And any other cosmetic questions that you may have, feel free to shoot them over. We'd like to continue to do these Facebook Lives. We had some good feedback and hope to do some more in the future. So if you have any ideas about anything, let us know. And
Megan Bender just joined us.
Oh,
Hi, Megan.
Hi, Megan. So any questions that you guys have?
Megan's not allowed to ask questions.
Yes, she can ask questions.
No.
So we're gonna get started. So today we're talking about what?
Well, I think he already said
Yeah,
it.
neuromodulators.
Today we're doing neuromodulators, so those are your, people know the brand names a little bit better, Botox, Dysport, Xeomin, and the newest one, Jeuveau. And then any fillers like your Juvederm or Restylane, Radiesse, Sculptra.
Okay, cool.
So,
Paradise is watching you, Danielle says, just so you know.
Oh, hi guys.
hi, Danielle.
Way to make me nervous.
So why don't you go ahead? So the biggest question we had people ask us in advance of today was, how do you know which product is right for you?
Go ahead, Michelle.
Okay, so are you talking in terms of the neuromodulators or fillers?
Well, let's talk about the neuromodulators
We'll start with
first.
that first.
Yeah.
Okay. So there are 4 different ones that are on the market right now that are FDA approved. Botox being on the market first, to Jeuveau being on the market more recently. Typically, there's different reasons why a patient would try one over the other, whether it's pricing, whether it's something they're more familiar with, if they've heard about their friends having one product or the other. I usually, when we do a consult with the patients in our office, we kind of go through all of them. They're more similar than they are different. And I typically just try to encourage patients to try all of them at some point, and they can make their decision. It's very subjective as to whether they would like one over the other.
A lot of patients that have already been on, like say Botox, that's the one that came out first, you know, they may be loyal to Botox and won't try to talk them out of it if they have good success with it. Sometimes if they've been on it for a while and maybe they're just not getting the effects that they used to have, now we have a lot of options. We can kind of go to another or to some of the other newer products. But like Michelle said, they're very similar. Some people may take towards one than another, so it might work quicker. One may work quicker than another. One may last longer than another one, but we find that they kind of all work very similarly.
So a lot of times people get it confused if they need, Botox versus a filler or what it is. So can you go through us and tell us the difference between the products and what you would use them for?
Yep, I'll go.
Go ahead.
Okay, I'll go and then you fill in.
Okay.
So a lot of times you're right, patients will come in and ask for a filler when really they need more of a toxin or vice versa. So what I usually try to hit home with the patients and make it simple to understand the difference is the neuromodulators are going to help more in the muscle. They work in the muscle to help relax those fine lines and wrinkles that we see. So common areas that we treat are in between the eyebrows, the forehead lines, the crow's feet, on the upper face. And I always explain to patients, if those are the lines that are bothering you, we're not necessarily treating the line with the Botox or Dysport or Xeomin. We're treating the muscle to help relax that contraction. And in turn, it's going to soften that line. And when I have patients who have very deep lines and they're requesting filler, I usually try to be a little bit more conservative and suggest that they stick with doing a treatment for a while, and over time, those lines are going to continue to soften if they're consistent with the treatment, and also they won't be as deep as they continue to, if that's making sense. The filler is kind of self-explanatory. It fills. So as we age, we get volume loss throughout our face, and the temples and the cheeks, the tear troughs, lips,
Look at
jawline.
my face compared to Michelle's, so that, you'll know loss of volume.
He also has
good
way
volume.
less body fat than I do. And that's another important factor too, I think, to explain to patients is sometimes when people have higher body fats, their face is a little bit fuller. So filler is a natural way to help replace or enhance the volume loss that we have over time. And everyone's a little bit different. I have patients who are in their 20s who can use more volume in their cheeks or their temples than certain patients in their 40s. So it's not necessarily an age thing or one size fits all. It really depends on the person.
Yeah, we used to kind of basically say that the Botox and some of the neuromodulators are for the upper face, because the lines that occur in the upper face, like the forehead lines, the lines here are called the glabella, or what some people call them like the credit card slots, or the 11s, the crow's feet. They're all made by the movements of the muscles. So when we squint or we raise our eyebrows up, that's all muscle. And what they do is it relaxes those muscles and relaxes the fine lines. Whereas the lower face, like Michelle said, is volume. And we're trying to restore volume with fillers. We used to fill lines. Now we fill more areas and fill more volume. So rule of thumb is that we use fillers kind of more, not exclusively, but more lower face. Or the kind of the cutoff is the eyes, and the neuromodulators up. But now we kind of use we use everything all over, because we're now
body.
molding the face and softening the lines. Yeah, we use the hands, necks, earlobes for fillers, or all kinds of applications.
How do you know how much you need?
Okay, so I'll talk about fillers, you talk about Botox. So for fillers, it depends, kind of going back to everyone's different. And like I said, I have some patients who are younger who need more than some of my older patients. So typically I tell patients you can, depending on how much correction they need is how much filler we're going to use. So I usually give a ballpark, like if we're going to start with the upper face, which is how I tend to treat, I like to start up and get more of a lift and replace the volume naturally, and then use less as we move down. I usually say let's start with 2, maybe 3, depending on age and the volume loss. And then as we're filling and doing the treatment, we may need more or we may need less. It's kind of hard to say you're going to need exactly 2 syringes and I can fix every area on your face until you start filling, and then you know, okay, no, I need less than what I anticipated, or I need more. But typically most patients in like a 20 to 30-year-old range can get away with anywhere from 2 to 3. 30s to 40s, you're looking at anywhere from 3 to 4 syringes, and then up from there typically.
Yeah, I to add to that, I think it depends on the person, depends on their face, how much body fat they have, what their expectations are. That's really important. So we may have like, well, this is the way I want you to look, but if they don't want to look that way, we have to kind of come somewhere in the middle and give them proper expectations. Expectations are kind of huge. So it really depends on the person, and we have to kind of tailor it to what they want and what their expectations are.
And budget as well.
Sure, that
So
definitely plays a role.
that's something that we work into. If a patient comes in with a certain number that they want to spend, then we try to meet that expectation, or we're very realistic and say, okay, well, this is what we can achieve with that. And it's not a one and done treatment. So there's always room to add more. And I usually explain to patients it's better to treat more conservatively, where we do a little bit at a time and we bring you back and we form a relationship and a good rapport.
Yeah, it's better to do too little than do too much. As far as the neuromodulators, it used to be back in the day when we first started using them, we would want the patient to be frozen. It was kind of like that stereotype, like I'm really upset at you, I'm really happy. So there was no expression. Now we're really trying to make it look natural. It's all about looking natural. We don't want people leaving or going home and then saying, I look unnatural. I look like I've had something done. The whole goal is to not look like you have had something done, but to look good. Like, so someone says, you look good. Like, what are you doing? We don't want
You're
them
good
to look
coming
like,
here to the Center for Skin Wellness and getting treated by moi or him.
correct. Correct.
How long does it last for?
So for the neuromodulators like Botox, Dysport, Xeomin, Jeuveau, on FDA label, they all last for 3 months. Again, depending on the dosing that we give patients and the look that they want, it can last a little bit longer or a little bit less. Typically, I'll tell patients that if they're going to stretch it, not to go past that 4-month line, because again, going back to the beginning of the conversation, we want patients to, one, have a good result, but two, it's not a one and done. It's better to come in before you go back to your baseline. And if you keep up with the treatment on a regular basis, then those lines and the correction that we have aren't just going to go away and we have to start all over. So anywhere from that 3 to 4 month range is probably the best in terms of the neurotoxins.
And just to interrupt you a little bit, what we were talking about before about how much do you give each person, when you start younger, you prevent the muscles from contracting fully. Mm-hmm. And the goal is kind of, you want to prevent the lines from forming in the first place. Not that I think a 16-year-old should do the neuromodulators, but you want, when the lines are first starting to form, or even before they even start to form, that's when you want to start. If you want to prevent lines, now some people like a little bit of lines, it all depends on your preference. But if you want to prevent those lines, start younger and keep up with it. You don't want, like Michelle says, you don't want it to go back to baseline where they're starting to contract those muscles fully. So you want to keep them on a regular kind of pattern. You don't have to, but for the best results, that's what you want to do. As far as fillers vary in how long they last. So there are an array of fillers, whether we're using hyaluronic acids, and you have your Juvederm products, your Restylane products. Then we have a calcium hydroxylapatite product, which is Radiesse. And then we have the poly-L lactic acid, or PLLA, which is Sculptra. So that's pretty good. I don't think I could have said that.
So depending on which product you're using, like the hyaluronic acids tend to have the least amount of longevity across the board, but when we place them in the temples and the nose, on the cheeks, they typically can last a little bit longer. Again, depending on the correction, if you're filling to full correction or if you're under correcting, then you're going to have a difference in how long the product lasts. But rule of thumb, anywhere from 1 to 2 years in the upper face. Around the mouth, we are constantly talking, smiling. If you're like me, you're eating all the time, and then it's not going to last as long. It tends to metabolize quicker. So anywhere from like 9 months to a year. It kind of just depends. Your calcium particles and the poly-L lactic acid particles tend to last more on that 2-year frame.
We have a question here from Dwayne. What are the risks of Botox injections?
Well, first of all, they're really good, safe products. Botox has been around for 50, 60 years. They were first using it on areas around the eye where you get ocular spasms. They use it, there's probably 50, 55 indications. The great part about these medications is they're very clean. They go into the system, they get metabolized, and they go out. So it's very hard to kind of mess up with it. You can overdo it, and if you're in the wrong hands, you can have problems with it. Like if you overdo it, if you give too much, you can cause weakness of the muscles. Like for instance, if you're injecting around in the forehead or this area, you can develop eyebrow depression, or something called ptosis, where the lid starts to sag a little bit. So generally, the biggest risk is if you overdo it, and then you'll have too much weakness in that muscle. Or if you put it in the wrong muscle, then you might weaken the muscle that you don't want. So if you're working around the mouth, for instance, and you inject into the wrong muscle, then you start to talk like this, like a pirate, and that's not good. But the good thing about it is, even if you do that, not that anyone wants to walk around for 3 months talking like a pirate. It lasts for 3 months and then it goes away. So it's kind of hard to mess up with that. There are very, very, very few instances where people have allergies to it. It's like incredibly rare. So as far as the neuromodulators go, it's one of the safest, cleanest medications that we use. As far as the fillers go, I'll let Michelle.
The other thing I was going to say for those if he was asking side effects
or risks of Botox. Okay.
So then maybe tying into side effects too, which is a common question I always have patients ask whether we're doing a neuromodulator treatment or a filler treatment is, will I bruise? So there are a ton of vessels throughout your face and a lot of vasculature. It's very rich in the face. So very common to bruise. So I tell patients anytime you have a needle going into your face or into your skin, there's always a risk. We do our best to minimize that risk and to avoid it because it's a bad feeling for us too when we have a patient leave the office with a bruise or call and say, I have a bruise going on. So typically that's the most common thing, or a little bit of swelling or redness afterwards too. So we like to tell patients not to do a treatment if they have an event or they're going to be seeing family or photos at least 2 weeks ahead of time. Give yourself time, space it out before you plan to do a treatment like this.
And avoid like aspirin, things that may
alcohol
make you bruise.
24 hours before,
Right.
fish oil.
One of the questions was, is it uncomfortable? So I guess that kind of goes with it, but I guess we'll talk about the treatment part of it. Is it uncomfortable?
The needle is tiny. It's like
It feels good.
Yeah. Some people like it. It does hurt a little bit depending on the area that you're injecting, but really minor. I'm a baby and I can take it, so it's really not that bad.
Also, to help minimize the discomfort, we usually offer numbing cream to our patients, especially before filler. So we'll have patients come in 30 minutes before, do numbing, we ice in between, so they're pretty comfortable. Sometimes I sing to my patients, I serenade them.
And make them uncomfortable?
They really love it.
It's like a counter
It takes their mind off of it.
Wow. So many questions with that one. Is there a favorite song that you like to sing?
It just kind of depends on my mood. A lot of genres I like. I can go from country to rap.
Can you give us a sample of what you just sing somebody?
You have to come into the office for that. I don't just do it for free.
Got it. Okay, so speaking of that, if someone's interested, how do they schedule a consultation? If they schedule a consultation, they get the treatment the same day. What does the process look like if someone's interested?
For the neuromodulators, oftentimes we'll do the consult. If they've never done it before, we'll do a consultation. We could actually do the treatment that day. It doesn't take that long. As far as the fillers go, we generally will do a consultation, but we won't schedule filler the same day. That takes a little bit more time, and we don't want to rush through it. So generally, we won't do it the same day for a filler.
So speaking of time, how much time can one expect for an appointment for the neurotoxins or neuromodulators, like you said, versus the fillers? What would they schedule on their calendar if they were coming for an appointment?
Okay, so for neurotoxins, like Dr. Rob said, it's a pretty quick procedure and very quick consult. So usually if you're doing a consult with that, in and out, 20 minutes total, because we spend time talking and answering questions, drawing up the product, and then injecting. As far as how long does the injection part of that take, if we're just doing upper face, that can take less than 5 minutes. If we're doing upper, lower, neck, any other areas, then maybe you're looking at 10-15 minutes of injecting, but quick. With your filler, that's a little bit more invasive, and the consult time is also longer because we're spending time with you.
And we take photos. We always take.
And we're always doing pre and post photos to show you the difference and for us to see the difference. Fillers can take anywhere from 30 minutes to an hour. Again, depending on what areas we're filling, how much filler we're using, if we're using just needle or if we're using the cannula technique, which is another technique that helps to reduce bruising as well.
Okay. Anything else that you think is important for people to know if they're considering, getting one of these treatments done from you guys?
The one thing that is really cool about these procedures is that they're not permanent. some are short-lived, 3 to 5 months. With the neuromodulators, the fillers can last up to 2 years, but generally they're limited. And what that allows us to do is kind of work with your face as the face ages. So we're not putting anything permanent in, because when things are put in permanently and then the facial structure changes, the bone structure changes, it starts to look weird, it starts to look different. So this kind of allows us to kind of mold the face as we age. It really gives us kind of the opportunity to say, all right, well, what are we looking like now? Or maybe we've lost weight, and you lost weight, and that changes the way that we do things. That gives we don't want to use this filler, we want to use that filler. So this really gives us flexibility, and it's very non-invasive. It really, there are very few things that can go wrong. So it's kind of an exciting time to do these cosmetic procedures.
Yep, I agree.
And so how does someone book an appointment to come and see either one of you?
You pick up the phone, you call our office, and usually if you just say, I'm interested in talking to Dr. Rob or Michelle about one of the treatments that you guys offer, they'll book a consult with you. Or if you're pretty adamant and for sure that you know you want to do something, they'll just book the treatment time with you as well. I'd say that's probably the easiest way to get a hold of us.
Yeah, either call us 907-7372, or you go on our website or book it through Facebook, smoke signals, any which way.
One last question that just came in. Are there any benefits that are not commonly known to these treatments?
Benefits not commonly known. Well, we could spend like a whole nother hour on this. I would say, if I'm answering the question correctly, maybe like other areas that you would treat, or...
I mean, we do use Botox for underarm perspiration for something called hyperhidrosis, because it kind of shuts down the sweating process for about 6 months. That's one of the indications that we use it for. We don't really use it for
hands or feet.
And feet. You can, but it's very painful and it doesn't work that great. It's kind of one of the procedures we don't do very commonly. Some people do say that it helps if they have sweating in their forehead, that it kind of cuts down on that. Again, it's not indicated for that purpose. So that might be an example of some of the things that it does.
From a filler aspect too, I would say when we do consults with patients in regards to the calcium hydroxylapatite particle filler, that is a filler that helps to not just bring in volume or water from the molecule, it also helps stimulate natural collagen. So certain patients can really benefit from that and like that aspect. So there's little nuances between the fillers that might be better for someone. And then another area that we like to treat that sometimes isn't often spoken about, but patients, when we do talk about it, they're like, oh wow, I didn't know that, is putting filler in the hands, putting filler in the neck or the chest. So those are also earlobes as well, which I had just posted something like a week ago about that. If you haven't stretched out earlobes from earrings that are heavy, which
go on Michelle's Instagram.
Then those are other areas. So it's not just your typical like, oh, I'm only going to come in and get cheeks, and where patients get worried and they're like, I'm going to look like a chipmunk. So it's not just filling one area or overfilling it. There's a lot of different uses for fillers and the neurotoxins as well.
And the follow-up question was, so muscle relaxation, rehabilitation. Is there any benefit for using the products for that type of thing?
I think they were referring to like muscle spasms. So that's kind of not our expertise. Neurologists use it for migraine headaches. They use it for something called torticollis, which is spasm of the muscles of the neck. It's used for lots of bladder spasms. It's like I said, it's got over 50 indications. So we really try to stick with the cosmetic use it. We don't use it for those kind of purposes.
The last question was from Nancy. Can she get Botox today?
Absolutely.
Always. That's actually a good question. So for our returning patients, sometimes we have a lot of patients who call and they're like, I want to come in today. They need their emergency Botox. So for the existing patients, it's really easy to get an appointment that way. We have kind of the map of what we normally do. It's just drawing it up. So those are always easy follow-up appointments to do.
And often, even if you're a new patient, a lot of times we can get you in that day too. We can squeeze you in. If not that day, we can get you in within a few days. So
Dr. Rob loves to stay late to take those patients.
that's right.
Speaking of Dr. Rob and men, so do a lot of men have the procedures done?
Oh yeah, absolutely. It's becoming more popular with men. Men, I think, have always been a little self-conscious. They just don't want to admit it. But I think that more men feel more comfortable coming in and doing these procedures. So I've been doing it on men for years now. It's just becoming more acceptable and more
Less
commonplace.
taboo.
Yeah. So and for filler as well.
Those are all of our questions.
All right. Thank you guys for
Thank
joining.
you.
If you have any other questions, then make an appointment and you can come in to see us. You can also visit the website or Facebook and Instagram pages where we try to keep you guys updated on events that we're having in the office and specials that we're running every month. And that's all I have for you.
Yeah, and if anyone has any ideas of what you want to ask us in the future for these Facebook Lives, just give us a shout. We'd be glad to talk about it.
But one final question before we go. Sorry. Is the duration the same for men and women?
I think it depends on the man and depends on the woman. So I would say not really. Maybe men can kind of have a little bit more faster metabolism than women, but in general, I don't think there's that much difference.
Okay. Well, thank you, Dr. Rob and Michelle, and thank you everyone for joining in today. We are done with our Facebook Live.
Thank you.
All right, bye.
Bye, guys.